And so my last question, and this is kind of looking for that silver lining. I tend to say to my clients in the clinic who are frustrated with a stiff knee, if it was my knee, and this is totally honest, I would rather have a stiff knee than a loose knee. To me, from a function perspective, I can make a stiff knee looser over time. Might not happen quickly, but with time and dedication, I can improve a stiff knee, and a stiff knee is stable. A stiff knee is still going to allow me better function than a loose knee, because I've seen some loose knees. You can't, I mean, other than
No.
surgery, I don't know what you can do for a loose knee. I don't know, so kind of what's your take on that? If you had to pick a necessary evil, too stiff or too loose, what would be the choice?
Absolutely. Being a little stiffer would be always in favor because you're right. A loose knee, the problem with knee replacements themselves, so the parts, they have some inherent stability, but you don't have your ACL anymore. You
Right.
probably don't even have your PCL depending on the style of knee replacement you had done. You just have your ligaments on the inside and outside of the knee. The number one stabilizer of your knee is the muscles, right? It's the quad, it's the hamstrings, and it's them working in conjunction at the right time to provide stability. But if mechanically that knee has too much play in it, it's too loose. There's just a certain point where your muscles can't even overcome that. So things like going up and down stairs, things like not falling down, those are two big things. You can
Yeah.
still do that with a stiff knee, and you're right, pliability of tendon tissue, things like that, using some of these braces, using some of the, even molding static braces for patients and doing different things over time to help them regain flexibility. Because, still, when you take the gold standard for knee replacement, we say the forgotten knee. Most people do not rate that on a form after their knee replacement. Say, I don't think about my knee for at least a year.
Yep.
So to your buddy that's at 14 months, it can still happen for him. Will he always get the range of motion that he really set out for? Maybe not. But I'd say sometimes the other part is don't get so hung up on one number or one
Right.
metric. If he's still able to go out and take a walk, go take a hike, go even jog lightly. I tell patients they can play tennis, they can ski if they've skied before. I don't usually encourage them to start skiing because it's such a high fall risk activity. But if they were a
Sure.
good skier before, go back to it. I've even told patients if they wanted to, they could skydive. So,
Wow.
I think you got to live your life, and the chances of bad things happening to you are always out there.
They are.
You gotta know what the pluses and minuses of or what you're getting into. And as long as we can, like I said, we can have that honest conversation, have some shared decision making about what you're doing and why you're doing it, then it gives me the best chance to be able to help a patient along to get to what they need.
And I think something you just demonstrated, and this is what we'll wrap up with, is, it's so important. Like in physical therapy, I always say patients should really have the opportunity to get to know the therapist they're going to be working with. Me as a therapist, I'm very different even than with the therapists that are within my clinic, from a personality perspective, from a philosophy perspective. And it's no different with surgeons. There's certainly
Sure.
surgeons that are going to connect with different individuals in different ways. And so while all surgeons are technically skilled, I think it's so important to be able to choose the surgeon's personality as much as their knowledge and as their resume, because that's such an important component, being able to ask these questions and not feel intimidated or stupid or like I don't have time to have this discussion with my surgeon. So, the things that you say, certainly not every surgeon is going to say. And I just think these platforms, video and whatnot, give us the opportunity to say, hey, look, this is a real human being, Dr. Abbott. This is a real person that is willing to sit down with you, have this conversation, and make the best choice for you, the patient. So that being
Yeah.
said, if we're talking to local people in this area, what is the best way to connect with you?
Sure. So, the best way to connect with me, my office, I'm Mercy. Well, you can find me on mercy.com. There's a way to online book through our website. You can search for health providers there. Just type in James Abbott. I go by my middle name, Doug, but you'll find me as James Abbott, MD. The other way would be to call the office number, and that's 513-981-6784.
Awesome. And I'll put all your contact information for Mercy down in the description of this video. I just want to say one more time, like the information and the time you just took today is phenomenal. And this will literally be helping people for the next decade, because things aren't going to change that much. People are going to have knee pain in 10 years, osteoarthritis in 10 years, and they're going to be looking for surgeons just like you, and they're going to have these questions. So from the bottom of my heart, and talking as, you know, the representative from the knee replacement group, thank you so much for coming on. Hang on a second. Let me wrap this up.
Sure.
So guys, if you have any questions, if you need any other information, absolutely let me know. I'll post this full video out to the group, and then I'll break it up into the segments so that if you're looking for a quick reference, you'll find the answer to your questions.